Hi guys, so chapter 14, part 3, last part. So now that we already talked about vehicle transmission, we also have to keep in mind that vectors can transmit the disease. And when I talk about vectors, I'm saying arthropods. So arthropods can be insects, right? And can also be all organisms where the microbe can be transmitted through. So if the transmission happen without the microorganism entering the body of the arthropod, you call that mechanical transmission. So if you look at this picture, this is mechanical transmission, right? This fly has microbes on its feet, and this is how it's transmitting microbes, for example, to this burger, right? And whoever is gonna eat that burger can contract diseases that are typically transmitted like this. For example, typhoid fever, bacillary dysentery, or shigellosis are diseases that can be transmitted by mechanical vectors. Biological transmission is when the pathogen is involved in the reproduction of the microbe. So the microbe enters the body of that vector and it reproduces inside the body. Usually this is the case for protozoa and helminthic diseases, where for protozoa, a lot of times you have the microbe entering the biological vector and reproducing inside the vector and then transmitting it through a bite where they suck, they have like a blood meal, and then they transmit in their saliva to the other host, which is in our case the humans, that microbe. Okay, so the microbe can be present in the saliva, it can be present in the feces also of that microbe, of that vector. So for example, let's give an examples of biological transmissions here. Leishmaniasis is transmitted by a protozoa, and sandflies are the biological vectors that can transmit leishmania to us. Another example would be malaria that cannot be transmitted without the Anopheles mosquito. In the case of helminthic diseases, you have other biological vectors. For example, snails can transmit schistosoma to us, where the snail is usually, in the case of helminths, the biological vector is going to host the larva stage, the less developed form of that worm, right? And so, which is the larva, and then the larva is going to infect us, and in humans the sexual part of the reproduction happen, so that's where the adult lives. So usually vectors for helminths carry the larva stage of the microbe. So now we're going to talk about hospital-associated infections, or HAIs. So they are acquired while the patient is receiving treatment in a healthcare facility, in a hospital, in a clinic. They're also called nosocomial infections. They affect 1 in 25 patients that are hospitalized. So it's a really important way of transmission of diseases, right? It increased 36% in the last 20 years. So we started to have this type of infection being recognized in 1940, and it all started with Staphylococcus aureus. And Staphylococcus aureus was being treated with antibiotics, and they started to get more and more resistant to antibiotic. And in that case, one antibiotic that was used effective for a long time was methicillin. And methicillin, the Staphylococcus acquired resistance against methicillin in the 80s. And in that case, you created a pathogen that is called MRSA, methicillin-resistant Staphylococcus aureus. And this pathogen was super hard to treat, okay? So because the main antibiotics that they're using, would not be effective here. And then when they started to treat this microbe with vancomycin, then they were able to eliminate it. But at the same time, Enterococcus started to develop resistance to vancomycin. So the VRE is the vancomycin resistant Enterococcus that was created, the new monster, after the MRSA. Okay, so this is how these stories are usually told, where antibiotic resistance, we're going to learn about that. It happens inside hospitals, and this is part of the problem, okay, where you don't have a good enough antibiotic to treat microbes that are already so used to that environment where antibiotics are used all the time, like in a healthcare facility, right? This health-associated infections happen because the host is already compromised, right? The patient is already in a situation of debilitation, and the immune system is weakened. So that's going to cause that chain of transmission to be higher. Microbes that are already in the hospital environment are another reason why these conditions happen. Also, patients, for example, that have open wounds or burns have a totally open door for these infections to happen because the skin is not there to protect them, right? It's also important to notice that hand washing, even though it's such a simple method, is only properly done in 40% of the time by hospital staff. That's why it's so important to learn about hand washing, right? So microbes in the healthcare compromise host and the chain of transmission, which can also be induced by not washing hands, for example, and non-poor hygiene conditions, are responsible for hospital-associated infection. These are some bacteria that are usually the ones that are present in hospitals and cause this type of infection. It's important to note too that transmission can happen through direct contact with the hospital staff to patient or from patient to patient, and also through fomites, because in hospital you can share equipments, when the patients are doing exams, you can share instruments, needles, through gloves. So all these can be transmitting these diseases, okay? Also, disinfecting tubes and where patients bathe is one way to avoid it. Hand washing, cleaning instruments really, really well, using disposable bandages and intubation, and also have infection control committees. Okay, so catheters, surgical wounds, burns, ventilators, breaks in the ventilation, the AC that controls the temperature in these facilities are all really important to be taken care of to avoid this type of infections. So that's pretty much what I wanted to tell you about this. Yeah, this is the story about MRSA that I just told you. And with this, we end chapter 14, and I'll see you for the next chapter. Bye.